Further debate? The member from Ottawa South.
Thank you very much, Speaker, and I'm really pleased to speak to my colleague's bill. And I know he put a lot of effort into this, and I know what his intent is, despite what I hear in here from some members. 2.5 million Ontarians don't have access to basic primary health care, a nurse practitioner or a family doctor. That's forced too many families in our province to use their credit card instead of their OHIP card to get access to the basic services they need. Your access to basic health care should not be based upon your ability to pay. That's a thing that I thought we all agreed on. But it seems it's like the Wild West now, and this government doesn't want to do anything about the expansion of clinics with memberships and charging a fee for basic primary care. That's the first thing this bill moves to address. And there seems to be no desire on the part of the government to recognize that it's a problem. I know that it is. I have at least 2 of those clinics in my riding. And who are the people most affected by doctor shortages? We're all affected by it. People of lower income, new Canadians, rural, northern. These are the people that are having to pay, if they can. That's wrong. In my books, that's wrong. The second thing is, nurse practitioners are a critical part of our healthcare system. They can help us through this primary care crisis. So what my colleague's bill attempts to do is to say, we need to bring them in. We need them to be part of the system. We need to include them. We need to make sure that they're compensated properly. We need to make sure that they have things like pensions and benefits and an opportunity to practice their craft without having to hang out a shingle and ask a patient to give them their credit card. Those are the 2 things that this bill attempts to do. So I don't quite understand what's wrong with that. Now, if we want a history lesson, guess which government froze the expansion of nurse practitioner clinics for 6 years? This government. 6 years. Right? 6 years. Not one from 2018 until they were announced, and as one of the members from the other side mentioned, the money hasn't flowed yet. So, 2.5 million Ontarians without access to basic primary care, a nurse practitioner or a family doctor, is a serious problem. So, I want you to think about this. Here's a few numbers. And these are numbers that are lower because they're from 2022. So they're higher. In the Bay of Quinte, 39,000 people. Mississauga Milton, 28,000 people. Etobicoke Lakeshore, 21,000 people. Essex, 13,000 people in your riding, sir, don't have a family doctor. Scarborough Agincourt, 14,000. Now, if you want to go and check, go on the OMA's website. Don't believe me. Don't believe me. It's a serious problem because if you don't have a family doctor, it's hard to stay healthy, just basically healthy, right? Getting good guidance about what to eat. If you don't have a nurse practitioner and you have a chronic disease like diabetes or a heart condition, wow, it makes it even harder for you. And if you don't have access to basic primary care, a nurse practitioner or a family doctor, and you're at risk for cancer or a stroke or heart disease, wow, you're in pretty rough shape. That's why it's serious. They call it primary care for a reason. And you know what that reason is? It means it comes first. And if the thing that doesn't come first isn't there, it doesn't work for people very well. And that's the point and the intent of this bill, and I encourage all members in this House to support it. Thank you.